For those of us at the Burnet Institute, where we have such a large focus on equity in global health, providing vaccines for COVID-19 to populations around the world is essential on a moral basis. We should not allow COVID-19 to run rampant through Africa, through much of Asia. But from a selfish perspective, for someone who doesn't care about global health, it's still important, because while the virus is running rampant in the rest of the world, it's producing new variants that will cross back into our population because of unlimited global travel. No one wants to see our international borders shut permanently. And even when our borders were largely shut, we still had Delta introduced, we still had Omicron introduced because we didn't have adequate quarantine. We can't stop the virus getting in. And so if it's spreading around the world, it will keep coming back. And I'm old enough to remember when smallpox was eradicated from the world. And the reason the world ended up deciding to eradicate smallpox was exactly the same reason as this. The US and Australia and other mostly Western countries used to immunise all their population against smallpox. But while smallpox was common in the world, it was a losing battle. And in the end, it was cheaper to eradicate smallpox from the world by immunising everyone and just stomping on outbreaks. Now, I'm not at all hopeful that we will eradicate COVID-19 completely, because it's so readily transmitted compared to smallpox, for example, up there with measles, which has been very hard to get on top of. But I think we can get it to a level where it is not replicating so quickly that it's causing massive disruption to health systems around the world, and not replicating to a level where we get new variants every few months.